Hello, my name is Johnny Gage. For the next 15 minutes, we're going to dig down into data to analyze the African American treatment admission rates, completion rates, and minority representation in Oregon's addiction treatment system. We're going to try and paint a picture of where African American treatment and recovery has been, where it is at, and where it's going. This chart is looking at Oregon African American treatment admissions as a percentage of all Oregon treatment admissions from 1992 through 2013. We can see that African Americans as a percentage of all treatment admissions has been declining over the past 20 years, from 5.7% of all admissions in 1994 to 4.1% of admissions in 2013. At the same time, African Americans as a percentage of Oregon's general population have been increasing. As you may notice, African Americans make up slightly more than 2% of Oregon's general population. You may be thinking that African Americans do not seem underrepresented in Oregon's addiction treatment system. Yet, the truth is they may soon be underrepresented if the current trend continues. Treatment admissions for African Americans in the Tri-Counties has declined about 15% over the past several years. The biggest decline in new African American treatment enrollments has been in Multnomah County. Now, in all fairness, treatment enrollments for everyone has been declining in recent years, not just African Americans. Nearly 10% of Oregon's 12 and older meet the diagnostic criteria for addiction treatment. According to the National Survey on Drug Use and Health, Oregon is one of the top 10 needing but not receiving drug treatment states. In fact, we rank third in the United States for people needing drug treatment but not getting it.
Are African Americans underrepresented in treatment? Of course they are. Everybody's underrepresented in treatment.
This chart is looking at treatment need for African Americans versus all other races. Over the past decade, nationwide aggregate annual data reveals that approximately 4.1% of African Americans needed drug treatment in the past year, compared to 3% of all other races. So when we see this chart and it appears that African Americans may be overrepresented in the Oregon's addiction treatment system, you must keep in mind that African Americans simply have a greater need for drug treatment services, and that their numbers as a percentage of admissions have been declining over the past 20 years. This is concerning. Oregon's triple aim calls for health equity and increasing the quality, reliability, and availability of care for all Oregonians, including African Americans. But we're trending away from this when it comes to African American substance abuse treatment, and this trend has deadly consequences. Unintentional overdoses have been increasing over the past decade. Native American males and African American women have the absolute highest rates of unintentional overdose. Yet, despite all of this, new addiction treatment admissions are declining, not increasing. Even drug court admissions for African Americans are declining in Multnomah County. In 2009, 17.3% of drug court admissions were African Americans. Now it's down to 9.8%. This really begs the question, why were a greater proportion of African Americans participating in treatment in 1994 compared to today? And why have treatment completion rates for African Americans been declining? What was going on back in 1994? So much different than today.
Stay Clean and Project for Community Recovery, we got together. We got together some 25 plus years ago. There are literally hundreds of people, including myself, who have then been able to take what we learned in treatment operated by people that look like us and carry that forward to help You can't even untold numbers of people moving forward.
Stay Clean was staffed by peers who knew one another and depended on one another to help and support one another. As Stay Clean considered itself a spiritual program, its daily mantra and prayer was, Lord, help me to help somebody. Through a therapeutic community model, Stay Clean built a treatment center for recovery from drugs, alcohol, prison, violence, and ignorance. Stay Clean provided housing, employment, youth and family support services, recovery-driven therapy, and other social supports that were culturally specific. To address the need for additional social supports needed to promote the resiliency of the recovering African American community, in 1993, 3 Stay Clean alumni founded the Miracles Club, a peer-run organization in inner Northeast Portland committed to providing a social haven for its members. The Stay Clean program was founded in what was then referred to as Crack Alley. Starting with one rented house as the program facility, Stay Clean eventually purchased 8 houses that eventually served upwards of 60 co-ed residential inpatient clients. At any given time, the outpatient capacity averaged over 25 clients.
Stay Clean for me was an extremely amazing program in that it was totally a family atmosphere. And it was a program where even once you graduated, if you had problems, you could go back. Myself, I stayed there 7 months.
Living the Stay Clean experience, being that close around something positive like that happening, and it rubbing off. And it took me quite a few times of get a year relapse, get 3 years relapse, but still from Stay Clean feeling as though I could come back. I could come back and give it another shot. And as I said, being twin sometimes presents a problem. I remember Shorty Brown one time telling me, "Get out of here so your brother can get clean, so one of you can live." And for a little while, I made it my mission. I made it my mission to prove Shorty Brown wrong, and live and want to live.
Stay Clean was an amazing program to me also, and pretty much because most of the people that worked there looked like me, had been through what I had been through, and had become clean. It not only taught us how not to use drugs and alcohol again, but it taught us how to not live with criminal behavior, criminal thinking. I think that for me in 1994 when I went there, I stayed there the 6 months. Like I said, I left. I got a job at Hooper Detox, started out in laundry, ended up getting accredited, got my counselor's certification, became an alcohol and drug counselor. And so Stay Clean did a lot for me. It helped me to stay clean, and then it helped me to reach out to other people that were also in Stay Clean. You would always see somebody who had been in Stay Clean.
With hundreds of graduates to date, an overwhelming number of those African Americans working in the behavioral health, treatment and addictions field, as well as other social service disciplines, are former Stay Clean members.
With the advent of managed care, treatment has sort of looked differently than it had in the past, in the 90s, late 90s, early 2000s. I think that what's important is to sort of understand, and what's kind of lost in translation is the relationship between the counselor, between the staff, and between the residents in the treatment facilities. That's sort of been lost in translation, and what's taken its place is, medications being given, managed care sort of taking over, and just the entire treatment process has become McDonaldized.
So we've discussed declining admission for African Americans. We also talked about an amazing treatment program from 1994 that had hundreds and hundreds of graduates that are still clean and sober today, many of whom work in behavioral health care today. Now let's talk about treatment outcomes for African Americans. In the United States, whites have a higher treatment completion rate compared to blacks. A review of the literature reveals a lot of this is often due to poor engagement, transportation issues, funding, and a lack of child care. This outcome disparity is even bigger in Oregon. About 44.8% of blacks complete treatment compared to 53.3% of whites. However, there is some good news in all these numbers. Despite the fact that Oregon has a greater racial disparity in outcomes compared to the U.S. average, Oregon does have a higher treatment completion rate for blacks than the U.S. average. In Oregon, 44.8% of blacks complete treatment, compared to 40.6% in the national average. Oregon actually has really good addiction treatment services, better than most states in America. The problem is there isn't enough of it, and we have disparities issues that we need to work on. In 2011, the United States treatment completion rate was 43.8% compared to Oregon's completion rate of 51.2%. Oregon's treatment completion rate for blacks in Oregon is better than the U.S. average, but it is slipping a little bit in recent years, especially in drug court. In 2009, 35.7% of African Americans enrolled in treatment in conjunction with drug court completed their treatment. That treatment completion rate dropped to 17.4% in 2012. That's not good. Lastly, the addiction treatment field has been attracting less and less African Americans over the years. Increasing academic requirements and criminal history prohibitions have been discouraging for many African Americans. In a recent review of 70 job announcements, we found that academic requirements for substance abuse counselor job openings in the Tri-Counties has been increasing. Nearly 60% of substance abuse counselor postings, not in mental health, these are substance abuse counselor jobs, required a master's degree. Nearly 3/4 of these urban jobs required a bachelor's degree or greater. Typically, urban areas have the highest percentage of African American residents. At the same time, they also have the highest academic requirements compared to the rest of the state. As most of you are already aware, there has never ever been any research showing that degreed substance abuse counselors have better outcomes compared to non-degreed substance abuse counselors. In fact, some studies have shown the opposite. A recent SBIRT study found that baccalaureate SBIRT interventionists had better outcomes compared to graduate SBIRT interventionists.
Empowerment Clinic is an African American operated alcohol and drug outpatient agency. As a matter of fact, it's the only African American operated outpatient agency in the state of Oregon. When African Americans walk into Empowerment Clinic, and from the front desk to the counselor, to the administrative staff, to the medical director. So when they see African American faces, there is a certain value in that the client feels. And I think that experience is unique in that it gives the client a sense of comfort. It develops a relationship that might not exist with other treatment agencies. I think that it improves the outcomes relative to the success and the treatment rates of the African American clients that Empowerment Clinic serves. The doors of Empowerment Clinic have been open for 1 year since July of 2013, and we haven't experienced one client who's dropped out of treatment in that first year. Yeah.
So every client that's enrolled with you, none of them have dropped out to date?
Not one. Not one client.
So let's review these points and barriers before we close. 1. African Americans are being increasingly excluded from substance abuse treatment field due to increasing indefensible academic requirements and criminal history prohibitions. 2. Treatment admissions and outcomes are declining for African Americans. 3. This is likely due to poor engagement in programs, transportation issues, funding, and a lack of child care. So what can we do to improve engagement and outcomes? Well, we can have treatment services in the communities where African Americans reside. We can plan better access to services. A good example of this is Miracle's new partnership with Central City Concern in the Rose Quarter right next to the Max. We can also be sure to adequately fund both African American specific treatment and peer support services. Right now, the Miracles Club is the premier African American specific recovery support service provider in the Tri-Counties. Miracles Club has a proven track record of engagement and retention in their peer support services.
I think the peer program is successful because of the staff, what they're putting in. They're putting the energy in. Most of them have been there. So what they're utilizing is their experiences with the clients.
I'll close by saying thanks for the service providers, thanks for the treatment providers, all the stakeholders that are involved with making African American treatment a potential success.